Hello everyone, my name is Erin Slattery, and in this presentation I will be covering homelessness and mental illness as a public health issue that needs to be addressed through evidence-based practice nursing interventions. I will be giving a brief introduction of the concept of homelessness and mental illness as a public health crisis, providing a research question related to this topic, bringing forth some studies that have been conducted on homelessness and mental illness, provide a literature findings synthesis, and finally make a practice recommendation for community nursing. The United Nations declared housing to be a fundamental human right in 1991, yet the prevalence of homelessness has been widely ignored. Homelessness continues to be an intractable problem today. According to the Council of Economic Advisors 2019, in 2018, there were over 500,000 individuals identified as homeless on any given night. Only 65% of these individuals utilized homeless shelters, while 35% were unsheltered. Homelessness is often accompanied by comorbid conditions of chronic mental and physical health conditions, co-occurring disorders, and barriers to health care and affordable housing. American Public Health Association, 2017. The American Public Health Association cites concurrent homelessness and mental illness conditions with this population relying on emergency services. This overuse of emergency services leads to higher health care costs and increased stress on the country's healthcare infrastructure. Through research, it has become clear that the most effective way to ensure positive outcomes for individuals experiencing homelessness is to provide housing stability. Curry et al. 2018 and Kerman et al. 2018. The issue of homelessness needs to be addressed through evidence-based practice interventions. Researching how to serve this vulnerable population best will provide positive patient outcomes for individuals experiencing homelessness, and it will also decrease the cost of healthcare associated with treating this population. I will be addressing this issue because I understand homelessness as a problem that can be resolved. It is a matter of whether politicians will allocate resources to benefit this population. This presentation will cover existing research on interventions to provide housing stability, decrease rehospitalization rates, decrease the associated cost of health care for this population, and provide community nursing support and follow-up. This information will then be utilized to summarize this issue's scope and provide a practice recommendation for community health nurses. To understand the topic of homelessness and mental illness as a public health issue, it is necessary to formulate a research question. To do so, the PICO model will be employed. Blessing and Forrester 2020 state that the PICO method is best when necessary to determine an intervention's efficacy. The P in this model stands for the population. For this question, the population is individuals experiencing homelessness. I stands for intervention. In this presentation, the interventions are housing stability, supporting organizations, and community follow-up. The C in this model stands for comparison. In this research question, the comparison will be between the control group and those who received different methods of intervention. Finally, O stands for the outcome. The outcome for this research question will be defined as increased housing stability and increased use of appropriate community services. The PICO model information can then be utilized to formulate a research question to guide the research. For the purpose of this presentation, the question will be as follows. What intervention method is most effective at producing quality patient outcomes, increasing the use of appropriate community services, and decreasing healthcare costs for the homeless and mentally ill population? To begin searching for supportive literature for this issue, keywords must be identified so that search results yield quality research studies. Blessing and Forrester 2020. Blessing and Forrester 2020 suggest using information from the PICO model research question to guide search terms for databases. Following this advice, keywords to consider for this research would include homelessness, mental illness, homelessness and service use, housing stability, community nursing and homelessness, and Medicare cost and homelessness. In order to address the research question, several randomized controlled trials, mixed method studies, and qualitative analysis articles were utilized. These studies covered a range of topics, including supportive housing programs and the impact on Medicaid expenditures, experiences of runaway and homeless youths, community follow-up impact on rehospitalization, differences in care delivery for underserved homeless individuals, and the effect of housing stability on the use of appropriate services. These studies were all conducted by individuals in various fields, which encompass psychology, social work or case management, medical providers such as doctors and nurses, and public health officials. The value of drawing from research conducted from several different theoretical principles provides a well-rounded description of the issue of homelessness as defined through different perspectives, while including specialized intervention methodologies. Much of the research conducted on the homeless population primarily focuses on single, middle-aged white men. Using this section of the homeless population for research is not transferable to other groups of individuals experiencing homelessness. Conducting research solely on the single white men experiencing homelessness ignores the unique needs of women, racial and ethnic minorities, children, families, and LGBTQ+ community members. The research that pertains to white men experiencing homelessness is not representative of marginalized individuals who are also experiencing homelessness. For this reason, it is essential to evaluate whether the researchers in a particular study have focused on a variety of study participants who experience discrimination outside of their experience of being homeless. To answer the research question for this presentation, only studies that included diverse samples were utilized to avoid the bias present in much of the other literature. Throughout the research reviewed for this presentation, a common theme focused on the importance of housing stability. Curry et al. 2018, Kerman et al. 2018, and Castillo et al. 2018. According to the U.S. Department of Health and Human Services, 1998, housing stability is related to cost, quality, location, and concentration of individuals in an area. Programs to provide housing stability have been piloted in Canada and the United States. Kerman et al. 2018, Curry et al. 2018, and Lim et al. 2018 identified housing stability as the single most critical intervention impacting mental health and healthcare costs for the homeless population. Another intervention with some proven successes is supporting organizations. Castillo et al. 2018, Curry et al. 2018, and Watts et al. 2018 describe the impacts of well-functioning supporting organizations on mental health outcomes and appropriate service use in the homeless population. A prevalent issue for the homeless population is high rates of psychiatric hospitalizations or medical hospitalizations. Psychiatric hospitalizations for the homeless population are often associated with extended stays due to the severity of the presenting symptoms. The same goes for medical hospitalizations. Kerman et al. 2018. In the homeless population, mental and physical health issues go unaddressed until the individual experiences a crisis. Homeless peoples often neglect health needs due to barriers to accessing health care. One barrier associated with receiving health care for this population is cost. A large percentage of the population of individuals experiencing homelessness receive no Medicaid or Medicare benefits. Roos et al. 2018. Roos et al. 2018 states that this impacts the acuity of services used for treatment and rehospitalization rates. Rehospitalization risk is increased due to barriers to accessing primary prevention, and patients often require inpatient treatment. Curry et al., 2018. These barriers to accessing community-based or primary health care also impact the acuity of care utilized by the homeless population. Kerman et al., 2018. The possible interventions to improve health of individuals experiencing homelessness are varied. Curry et al. Studied the implementation of community-based follow-up and continuity of care. The goal of implementing this intervention was to decrease the rate of rehospitalization. Continuity of care has been shown in previous studies to decrease rehospitalization rates for mental illness. Community follow-up intervention to augment continuity of care for individuals experiencing homelessness did not result in the same outcome as when tested on the general population. The researchers found that improving continuity of care did not impact the rate of rehospitalization in this population either. Castillo et al. 2018 evaluated community follow-up to improve patient outcomes in underserved populations. This study showed that community-based treatment was effective at eliminating risk factors for homelessness in study participants. Roos et al. 2018 also had a similar approach and focused on transferring care to a community-based residential treatment center after hospitalization for mental illness. This study was the first of its kind to employ community residential care. The researchers found that this intervention was effective in decreasing the reliance on hourly-based mental health care by homeless individuals. Drawing from information from previous studies, it can be safely assumed that the decrease in cost of care related to this intervention is due to the housing stability that is created in the form of residential care. Roos et al. 2018 also found that discharging homeless patients to a residential treatment facility decreased their rates of rehospitalization. Kerman et al. Evaluated the implementation of programs to improve housing stability to decrease rate of hospitalizations. The Housing First program's use resulted in a decrease in rehospitalization and emergency room visits. The decreased rehospitalization rates and emergency service use decreased the cost of health care. To address the cost of high acuity health services, housing stability must be emphasized. Ensuring housing stability is the most reliable means of improving the homeless population's quality of life and health care. Before implementing an intervention such as community follow-up as studied by these previous researchers, the issue of homelessness must be addressed, which will significantly impact public health. Another factor that impacts care for the homeless population found during the literature review is the role which organizational philosophy plays. This is in relation to supporting organizations. Wads et al. 2018 found that an organization's ability to overcome barriers to care had a large impact on individual outcomes, and these positively rated supporting organization settings were related to positive psychosocial support and development for runaway and homeless youths. Based off of current available research, nurses and healthcare providers need to understand the importance of housing stability in supporting positive patient outcomes and decreasing the cost of healthcare associated with this population. Healthcare providers need to push for housing programs in order to address the problem of homelessness and the concurrent comorbidities. Even with the support from healthcare workers, a housing program to end homelessness in this country will not be swift enough to mitigate the negative effects of homelessness on such a large portion of the population. In order to provide support to individuals experiencing homelessness right now, healthcare providers can draw from current evidence-based practice guidelines to provide quality interventions in care. Enacting current best practice for care in this population includes housing support planning during discharge planning. Current best practice dictates that discharge planning should begin at admission. This is true for this population.